0800, WhatsApp 018-789-8899, tweet us at BFM Radio. Joining us now to talk about this is Associate Professor Dr. Muhammad Muhsin Ahmad Zahari, Consultant Psychiatrist at the Department of Psychological Medicine at University Malaya. Dr. Muhsin, thanks for speaking with us.
You're welcome, yes.
So, like we said, the Health DG spoke about empowering general practitioners, family care physicians with the skills to manage mental health. What were your first thoughts when you heard about this?
Yes, of course, in the context of Malaysia, where we are quite lacking in number of psychiatrists or mental health professionals, including counselors as well as clinical psychologists. This is the measure we should introduce now. The approach has been recognized, what we call it as task shifting. That means delegating the task from the experts to the rest of healthcare professionals. So I think for general practitioner and primary care physicians, they have important roles to help in addressing mental health issue, and I believe it can help to counter whatever the adversity of the mental health that occur. For example, reducing the extremists. We're talking about the reducing suicide or risk of abusive behavior, aggressive behavior. All this for long-term chronically can be helped by general practitioner and healthcare family care physician. And we are from time to time as well. It is like blessing in disguise as well, when they are empowered to do all these measures, because we can see so many private clinics or more family care physician around. So accessibility would be improved if they can also help to manage patients with psychiatric illness.
So typically speaking, as of now, what role do these doctors play when it comes to mental health care?
Yeah. Basically, for example, we have clinical practice guideline for involved in major depressive disorder. There are also guidelines for bipolar. So in the guideline itself, we talk about empowering for the general practitioner and general doctors, to help in managing all these psychiatric conditions. So, of course, among the primary important steps they can do, we call it like psychological first aid. That once somebody under very distressed, they actually can help to deliver, because the skill. Even like psychological first aid, is not confined to doctors, but it can be other healthcare personnel as well. Apart from that, for example, more details about psychiatric intervention, we're talking about, for example, giving a supportive therapy. Supportive therapy actually empowering them to listen, to listen from the patients, and to what they call allow the patient to talk to someone. That means the doctor has a role to facilitating the difficulties, for example, and also psychoeducation. We call it psychoeducation, about educating the public, those who come to the clinic, about importance of having healthy lifestyle, a good mental health practice, and this is the primary care physician as well as GPs can play. So they definitely have a important role in helping in this aspect.
So what sort of additional training then would a doctor go through to upskill?
Of course, it is very important for them to be what they call, for example, be trained in psychiatry, and most of the doctors basically when they are doing undergraduate in MBBS, for example, it is definitely for local universities. We have like in UM we have 8 months, 2 months or 8 weeks of attachment in psychiatry. So it is similar. Go to medical also, they have 8 weeks to surgical, so 8 weeks. So you can look here. Basically, the training is quite intensive, and they should be capable of addressing the basic needs of the mental health and providing treatment for those who are having mental illness. However, I have to be cautioned from this statement. Some graduates from overseas, not many, but quite few in number, they've not been properly trained. For example, for psychiatric training, they're not meeting patients. They just do in the class training, for example, or theoretical learning. This is a bit caution. These people, I think, needs a little bit of extra time when they do houseman, for example. They can do exposed to the psychiatric training, because in Malaysia, even now, it's good. Psychiatry has been one of the postings need to be completed by those who doing housemanship.
So, from the patient's perspective, what would it look like or what could it look like for mental health checks to be integrated into a GP visit?
That would be actually, I would say, overall it's good, because we are breaking stigma. Because now, even the place where we put our clinic, our hospital, has been seen as a very negative, perception by the community. The hospital itself. So when general practitioner able to help in handling psychiatric patients, the stigma will be less, because besides they are treating for diabetes, hypertension, they also can help for psychiatric patients. That's one. But I think the better thing is the holistic approach. So patients are not only being seen as having, physical illness, but they will be seen as the whole person, including their mental aspect. That's why, for example, in our clinical practice guideline, we put for any doctors, should have a screening questions. That means some sort of question that help them to ask the patients, whether any possibility this patient having mental illness or not. So if there is, then can explore further. But it should give a room for them to explore that possibility. And of course, some employer, for example, we encountered this. They're not so keen with if the patient, receiving treatment from psychiatric, with the stamp over there, psychiatric consultant, psychiatrist specialist. So when go to this general practitioner and receiving treatment, basic treatment, for example, if require, whether supportive therapy or whether they need antidepressant, it won't be identified as psychiatric patient. So this will be liked very much by the patient if our general doctor can help to manage this general or the basic case of mental illness.
So we have a question from Delma, who wants to know what can a patient expect if they were to bring up mental health concerns with their GP?
We also involved, from Malaysian Psychiatric Association, for example, and also I think now the Ministry of Health also, when we having clinical practice guidelines, they should be trained. So I believe from the GP end, they should be able to give a time. Usually in the general practitioner point of view or the primary care, the time is limited. They have hundreds of patients sometimes, so this is limit their time to ask about psychiatric patient. This is always what we get from them. However, if the patient able want to share some information about their mental difficulties. It could be as simple. I mentioned that, for example, about sleep. They have difficulty sleep, up to they feel they are overwhelmed with things happening around them. I believe this general practitioner or primary care physician would be able to further that conversation, to address whatever needed, to understand the basic needs of this patient require, in order to reduce this stress. So I think they have this capability. The only thing sometimes they have a perception that the patient not really like, if the doctor seems to ask about, because psychiatric questions sometimes, ask how you're feeling, everything can be sensitive to some people. So this is probably some, not a right assumption, but if the patient doesn't speak up about their emotion, about their complaint about mental health, this doctor probably not open up at the first moment. So they expect the patient to talk first, and they will can have further conversation and interview on mental health issues.
Dr. Mohsin, unfortunately, we are out of time, but thank you so much for speaking with us today.
All right. You're welcome. Okay. Thank you.
Thank you. That was Associate Professor Dr. Muhammad Mohsin Ahmad Zahari, Consultant Psychiatrist at the Department of Psychological Medicine at University Malaya, talking to us about a proposal, a recommendation from the DG that doctors, general physicians, and family care doctors be upskilled in order to be able to manage mental health. We'd like to hear from you. What